Hi, I'm Susie Welty. I'm a senior advisor of business development at the Institute for Global Health Sciences at the University of California, San Francisco. During the COVID-19 pandemic, my role stretched and expanded and morphed daily, including dipping my toes into domestic health work as we led training in contact tracing for the San Francisco Department of Public Health and the California Department of Public Health. Having been born and raised in Ecuador and spending my entire career on global health, mostly in Africa, including living in Tanzania for several years, domestic health was foreign to me. Through that experience, I was transformed, which started a journey that continues with WomenLift. I was on a contact tracing ship with a Black American colleague. My colleague shared a story about a woman she called who during the intake questions of demographics stopped on the race and ethnicity question and asked her, "Are you Black?" My colleague responded that she was, and the woman replied, "No one I ever interact with in the public health system is like me." When my colleague relayed this story to us, I felt sadness and also a deep sense of inadequacy. It dawned on me that I am not the workforce that is needed to be doing this work, that we needed to have the communities most impacted doing this work. This made me want to retreat back to my global health work where I did feel adequate. As the COVID emergency wound down and at the first opportunity I got, I took up my global health work. This feeling still gnawed at me though. Do I have the credentials to work in global health? I was born and raised in Ecuador, grew up in an Indian village where my mom ran a community clinic, but can I adequately represent the communities in low and middle income countries? I put these feelings aside and move forward a portfolio I'm very proud of. I work with partners to write grants to get funding for data science training for young women in Africa, something I'm passionate about. This is the leadership project I had in mind at the start of WomenLift. But after the excitement of learning we had been funded waned, and I couldn't shake the question of, do they need me? What value do I add? Our partners in Uganda and Kenya are very capable, and after recognizing the need for these types of training, bringing the partners together and writing the grant, I had the sense that I should step back and let them lead the work, which left me with many questions, one of which was, what do I do about my leadership project? And also, in this era of decolonizing, what is my role, and what is an academic institution in the US's role in global health? Do we take up too much space and too much money when things should be driven by our competent partners and LMICs? At the same time as we wound down our COVID contracts with the state, the end evaluations showed that the lack of diversity in our own organization impacted the ability to reach communities and foster an inclusive workplace. This felt like a confluence of my existential crisis, and the path forward emerged. The role for me was as an ally to confront the barriers that kept people, and especially women of color, from leading in our organization and to support women of color to rise to leadership positions. So I set out on an allyship quest, recognizing we could not continue to do the work we were doing being led by white men. I worked with a colleague to navigate the HR and political hurdles of getting 2 leadership positions posted, one for the domestic portfolio and one for the global portfolio, with the intention that they be filled by people who represented the communities we were aiming to reach. The path was much harder than I could have imagined, and I came to understand firsthand the structural barriers that propagate structural racism and a colonial mindset. It reminded me of a quote I heard: systems do exactly what they're designed to do. These systems were designed by a certain type of person to ensure their success, and it is not women of color. We did get these positions filled by 2 Black women, and my goal is to be their allies, to make sure they succeed in their roles by supporting them in business development and program development of the programs they see fit. I met with Shireen halfway through the year to talk about the evolution of my leadership project and my focus on allyship. She reminded me that I also needed to ask those women what they wanted in an ally. It cannot be self-defined. So I met with them, and their comments about allyship were, allyship cannot be self-named. It is based on trust and building relationships. Someone that will stand in the gap for you and point out who is missing in spaces. It's not performative, and it should be a little bit hard, and it needs to be strategic. The challenges women of color face in rising to leadership positions in institutions built primarily for white men are not merely hurdles. They're the vestiges of a system deeply rooted in structural racism and colonial mindsets. These barriers are often invisible to those who do not encounter them. But they're as real as the ceilings and concrete that have kept so many qualified, brilliant women from reaching the pinnacles they deserve. I won't lie, this year was hard. Relationships suffered because upsetting the status quo is uncomfortable. And going back, I would have done some things differently, especially in the realm of strategic leadership. I am a work in progress. The WomenLift journey supported my evolution, and the lessons learned and people I met will surely support my continued evolution and strengthen my voice as an ally.